everybody. Misty Williams here from Healing Rosie, and we are live right now with Isa Herrera, author of Ending Female Pain. And I'm really excited about this conversation we're going to have today. And I hope you guys get a lot out of it too, because we've been talking the last few weeks a lot about women's hormones. We had a conversation last month with Susan Bratton, and we talked a lot about female pain, vaginal pain, pain during sex. We have a lot of women in the community that are asking about the recommendations they're getting from their doctors to have a hysterectomy because they have fibroids, and there's women that are experiencing pain even urinating. So there's a lot of things that we need to consider when dealing with female pain. And I've actually been learning a lot about this subject as I've been doing all these awesome Facebook Lives and on the Fix for Female Hormones Summit, learning a lot from experts in our space about this area. I had no idea that there was such a thing as a pelvic physical therapist for women, but there is, and Isa is one. And I'm really looking forward to being educated. So welcome, Isa.
Thank you so much. I'm super excited to be here. Super excited to, come in and speak about this topic. That's my passion with your community and with you. Thank you, Missy. I really appreciate this.
Yeah, of course. Well, why don't you start by giving us a little education on the whole pelvic physical therapist thing, because there's lots of women who are struggling. One of the things that came up, just to provide some context for everyone watching and for Isa, we've been learning about a lot of the therapies that you can do to restore the entire vaginal area. PRP has come up a lot. Some of these therapies get pretty pricey. There was a thread that happened in our community a few weeks ago where someone was talking about how frustrated they are that they're experiencing these pains around sex as they get older, and they're concerned about not having the resources to invest in something like PRP. And someone else chimed in about, finding a pelvic physical therapist that might be able to help. And I've actually recommended that to some women in our community as I've been hearing about it, and women are having great results with it. So why don't you tell us a little bit about this area of physical therapy that most of us probably don't even know exists? And then also tell us how we can find someone in our area.
Sure. Thank you so much. I mean, the one thing that I didn't even know what a pelvic floor physical therapist was. And I was in PT school, and I was a personal trainer. I am a personal trainer and a physical therapist for over 30 years. And when I was in PT school, I learned zero about women's health. And it wasn't until I had my baby that I understood. I was like, what is going on with my privates? What is going on with my bladder? What is going on with all this pain that I'm having with sex? And I was leaking. And, and I was having pressure, right? I had no idea what was going on. So, I went on my series of what I call the Dr. Rose show, trying to find solutions. And I came up with nothing, which is, typical,
High
right?
five.
High five. With nothing. And what's really interesting is all of a sudden I'm like, this is a muscle like any other muscle in the body. And all we have to do is train it back to health, do some different types of exercises and massages. And what a pelvic floor physical therapist is somebody who focuses on the vaginal muscles, the anal muscles, the bladder, right? And what we do is we restore the pelvic floor muscles back to health, because typically when there's a dysfunction in these muscles, women are either leaking, we're coughing, sneezing, or laughing, which is over 25 million women in the US. 1 out of 3 women has pain with sex, which is incredible. That's 30 million. I feel like it's all of us. When I started doing all these millions, I'm like, well, I think we're in the majority.
Yeah.
Right. And prolapse, which is a big issue among older women, is pretty significant, and that's up to 49%. So when these muscles, they're like a beautiful basket or hammock, and they hold everything up. And when they're really when there's weakness, or where there's scar tissue in them, because remember, it's a muscle like any other muscle in the body, so it can get trigger points, it can get spasms, it can get scars, it can be weak, it can be tight, and it can be a combination of everything. And so we're sitting there trying to figure out why our orgasms are petering out, or why we're not coming at all, why we're running to the bathroom every 2 minutes and we can't sleep through the night, or why we can't even stand and cook because we have all this pressure in our vaginal area. And when we go and see our doctors, and there are some doctors that are enlightened, they're not all, but this is not taught in medical school. What happens is that there's no focus on those muscles, right? And especially, as this is not just an issue of postpartum women, right? Because everybody thinks, oh, postpartum women, the majority of the women I treat have no babies. So that's an interesting thing. Yeah. And so it's this dysfunction. So the pelvic floor therapist brings these muscles back to life. Helps you to straighten. A good pelvic floor physical therapist awakens the doctor within you so that you know how to take care of yourself. Because I don't like this whole going to the pelvic therapist forever and creating dependency, because that's just another issue. And I was just talking to a bunch of women in my community about this. And so the main thing with pelvic floor physical therapy is that you really need to know how to care for these vaginal muscles for your entire lifespan, right? Because everybody's like, do I have to do these exercises forever? I'm like, well, you brush your teeth every day, right? You're taking care of your teeth every day, right? Why are we not taking care of our vaginas?
Yeah.
And our bladders?
Yeah.
So yeah, there is work to be done, but many conditions can be healed naturally with the pelvic floor with holistic therapy. And so you don't really need all these surgeries or hysterectomies or slings, meshes that everybody is constantly recommending women to do.
Yeah. Awesome. Well, this is going to be a really powerful conversation for the women in our community because it's a big issue. So let's just dive in. I just want to let you guys know also that Isa has an upcoming free masterclass that I've shared the link with you in the status if you want to sign up, where she's going to be teaching us even more about what we can do to restore pelvic health. So Isa, why don't you just tell us a little bit about your background? Like, how did you become a pelvic healer?
Oh, wow.
Into this space.
Yeah. I mean, it's interesting, right? Because I was an orthopedic physical therapist, right? Which means that, I can take care of low back pain, hip pain, shoulder pain. To me, I call that simple orthopedics. Because once you start to deal with the vagina, everything else is easy, right? After I had my baby, I had a beautiful birth. Everything was fantastic. But, I kept going back to my MD saying, hey, listen, something doesn't feel right. And he says, oh, don't worry, you're just healing. That was the first visit. I couldn't sit. I had pain. I was leaking on myself. Sex was impossible. And I had all these things. Like I really couldn't function. So I go back to my doctor and he says, oh, no, you know what? Everything is fine. You're going to be okay. I said, okay, I'm just healing. I understand there's normal healing time for things. And then I went back and he says, you know what? You're just weak. You should be doing a lot of Kegels. And then I went and I did a bunch of Kegels, went to Dr. Google, did my research. And I started to leak more. I had more pain and then I couldn't even sit. Right? Because Kegels is like the panacea, right? Everybody says, do Kegels, do Kegels. If I hear that one more time, I'm going to explode.
Right.
And the thing is that a lot of women, at least 33% of women, are not candidates for Kegels. But this is what the medical community is continuously telling women to do, right? Go and do your Kegels or go and get a shot or put some numbing medication on your vagina. But these things are Band-Aid solutions. Then they're not going to take care of the root. So, I'm grateful now because if it wasn't for the postpartum recovery that I had, which was pretty horrific, I think I would have just been doing personal training and doing the other things that I was doing. So I'm really grateful for that because it changed the course of my entire life.
Yeah. Yeah. So you got into this area and you've been talking a lot here about Kegels or Kegels, however you're supposed to say it. I've been hearing about them since I remember as a little girl, my mom talking about Kegels. I don't know if her doctor recommended them to her. But why don't you talk to us a little bit about this? Because certainly most of us, if not all of us, have heard of them, and you have some pretty strong opinions about how to properly exercise the vagina, and you don't necessarily buy into the way this is conventionally taught.
Yeah, absolutely. And the thing is, I've treated over 14,704 women. Right. That's a lot of people. I don't think anyone can trump that, in the US. And over again, I kept, in the beginning of my education, I was like, why are we making this blanket recommendation for a Kegel? And what a Kegel is simply to contract the pelvic floor muscles, to squeeze them, right? And usually the recommendation is just to squeeze in general, right? But I have a program, I have over 13 different types of Kegels, right? Because you have to have different ways of doing things. So a Kegel is just a contraction. And the midwife, the OBGYN, and probably your personal trainer is going to tell you, squeeze your vagina, right? But the thing about these muscles is that, like in life, they like a certain level of balance and fluidity and flexibility and suppleness, right? Because they have to be open to receive, right? Especially during sex, and you want to be open to receive. For orgasms, for orgasms to be really delicious, these muscles have to be able to contract and then let go, right? And some women, if the muscles are too weak, you know, they're continuously doing Kegels because they're thinking, oh, I must be weak down there. But in reality, what I find is that many women are too tight. So that the Kegel is just making them tighter, creating more weakness, right? Because if something's really tight, then I keep hitting that one thing, then how are you going to have normal bladder and bowel function, right? It's because if they're really tight, constipation is something that comes from it. Refer pain. So some women feel like they have yeast infection or UTIs. And I tell you that over and over again, women with these issues with pelvic floor dysfunction, they say, I have a UTI. I'm like, don't take any antibiotics until you make sure. And they go back and they get the test and they're negative. Or they get a lot of itching in the vagina and then they say, I must have a yeast infection. And I said, please, before you do anything, just confirm that that's what it is. And these women come back with negative tests. And then I was like, what is going on here? And then I realized that the muscles are so tight that they're cutting the circulation and then squeezing on the nerves, right? And so you can get pain with sitting, you can get constipation. Oh my God, there's so many things. You can get this feeling like you got to pee all the time, or worse, you turn on the water and then you got to run to the bathroom. I mean, who hasn't experienced that, right? Even I experienced that. So for these kind of conditions where the muscles are too tight, Kegels is contraindicated, meaning you're not a candidate for them, right? And for women who have prolapses, if there's been a cesarean scar or a hysterectomy scar or a myomectomy or an appendix scar or a laparoscopic scar, sometimes that can create tightness too. But then you're getting these symptoms of a combo vagina. I call it the combo vagina, right? Where it's too tight and too weak. And so then you're like, then you go back and you do Kegels and then you don't feel better. And what I find is that you don't feel better, then you go back to the doctor and the doctor says, well, you're not feeling better. Let's do surgery or let's cut out your organs. And then that compounds the situation. It makes it worse. And then now you're left with a scar issue.
Yeah.
Right?
Yeah. So let's talk a little bit about that area because you actually chimed in to a thread on a conversation we were having either last week or the week before about this whole hysterectomy thing. So women come into our community all the time saying, my doctor's telling me I have a hysterectomy, or I should have a hysterectomy because of fibroids, or I'm having a hysterectomy next week. You know, maybe they've had really painful periods that are lasting a long time. Maybe they have a bleeding issue. Anyway, it just seems like for a lot of us, when we start experiencing pain or issues, that's like the mode of treatment is just, well, we'll just take out the womb and then, you know, all will be well. And now there are women who come into our community after they can't regulate their hormones. Their bodies seem to not even like hormones. There's other women who come in and it's completely changed their body's ability to orgasm, and they don't have orgasms that are the same. So there's a lot of things that happen after you have a hysterectomy that aren't discussed when a hysterectomy is prescribed. So I would love for you to talk a little bit more about this whole hysterectomy thing. Why do you think that so many women are struggling and needing to have hysterectomies in the first place? And how would you like to see women treating their own health so that they're not having to get hysterectomies?
Well, ironically enough, this is an awesome question because this is one of the things I'm passionate about. I'm passionate about pelvic health, but I'm passionate about saving women's organs. Okay, that's my
Right.
thing. Okay, because I know of the complications that happen. 19% of all hysterectomies occur because of a chronic pelvic pain issue. When these women get there or the uterus out, their pain continues. It doesn't go away, which is what the doctor sometimes alludes to, right? Hey, let's get it out. Everything's going to be better. But it's not, right? So, you know, we need our uteruses. And many times the culprit is the pelvic floor muscles, but no one is looking to these muscles for this harmony, for trigger points. And so what happens is they have pain and they're like, well, let's get rid of an organ because that's the problem, right? You know, let's get rid of the uterus. But then what happens and what the doctor doesn't say, which really makes me crazy, this is one of the things that makes me absolutely insane, is that 3 years, and this is in the research. So, I mean, I have access to the research as the MDs do. So this is not like, oh, Isa's the only one that knows this. No, it's out there in the literature, okay? There's no informed consent, which means that when you sit down and a doctor is recommending something, there has to be informed consent. Informed consent is all the pros and all the negatives that can happen. One of the things that they don't tell women who've had hysterectomies is that within 3 years, they're going to prolapse, depending on what kind of hysterectomy that's
What is
being done.
prolapse?
Prolapse means that the organs, right? Because there's been a structural change to the body. That means that the bladder, the anus falls into the vagina or outside the vagina, or even the uterus can fall into the vagina. So the pelvic floor muscles, like I said, is a basket, right? It holds all our organs in place. When there's been a structural change, a fascial change, right? Especially if it's gone through the belly, then everything is like sort of off kilter. And then what happens is everything starts to loosen and to drop into the vagina because they're not told to go and do conservative therapy of the pelvic floor muscles to keep their organs in place after a hysterectomy. So after a hysterectomy, what I find is that more women prolapse. Then they have scar tissue in the abdominal area that's not addressed, and that becomes a trigger point. And then that becomes pain into the groin or pain into the back or SI joint pain. Because the thing is, when there's a scar can behave like a messed up nerve, right? That can send you little symptoms into different areas. And this is also in the research. So, you know, I don't understand why this informed consent is not given, right? So the first thing is like, if any MD is recommending anything to do to your body, laparoscopic, and trust me, I had a laparoscopic surgery. My doctor didn't tell me what could happen. I just did it because I was desperate, and I get it. I've been there. I know how hard it is. And, you know, thank God that I'm a PT, and I know I finally figured out, I finally cracked the code, as they say, right? I cracked the vagina code. But a hysterectomy is a very serious thing. And if you have pain, you need to explore all kinds of conservative therapy first, you know, with, you know, functional medicine, as you know, all the things that you provide for your community, which is, by the way, they're so lucky to have you.
Oh, thank you.
They really are lucky to have you because you're bringing it to them. Because without this, they'll just be out there. And then things happen. And I've seen so many things happen to women unnecessarily. Yep. And so this forum is very important. And I'm grateful for it. I'm grateful that you're providing this. But I just, when it comes to like taking out your organs, like I had a patient recently and she had a little bit of swelling in her left fallopian tube and ovary. They wanted to take her ovary out. And I said, no. I said, this is coming from the inside. This is coming from the pelvic floor. There's something here. And I taught her what to do. I didn't even lay hands on her. I taught her how to care for herself, right? Because I do a lot of online telemedicine. She goes back to the doctor. Swelling is gone. The ovary is like beautiful. And he's like sitting there in shock. How did this happen? Well, it happened because we're learning slowly, and this whole awakening of women, we're learning how to care for ourselves, right?
Yeah,
so awesome. She went to a functional medicine, and then she did the massaging, and then she did the internal work, and she saved her own. She saved, not me. I just tell you what to do, and then you just go and do it. She saved her ovary and her fallopian tube.
That's awesome.
So I thought that was incredible. I was like, holy mackerel.
Yeah.
It's so beautiful to see that.
Yeah. I know this whole conversation around what types of exercises you do is probably like a 5-hour Facebook Live that we don't have time for it. Why don't you give a little sneak peek to really help women understand how you approach therapy in this area? And of course, my assumption is that you're going over this more in the masterclass.
Yeah, absolutely. The masterclass is a must attend. If you've ever had any like thoughts, or if you have any issues with your down there muscles or with your bladder, you must attend it, because it goes into much greater detail than what we can go on in here. But you approach this area the way you would approach your bicep muscles, right? You would approach first by self-examination. And that's really important, because so many women, I mean, this is what I find really funny. They're like, oh, I'm not looking down there. I'm like, well, if you don't look down there, you're not going to know what's down there. Mm-hmm. If you don't test yourself, then you're looking external to yourself, to someone to tell you what's going on with your own vagina, mm-hmm. which is insane. Yeah. That we don't even know that, right? And so the main thing here is kind of like, yeah, you exercise them, you massage them, you release them, you do different kinds of stretches to open up the pelvic floor, because they are the deep connectors, right? They're centrally located. So the lower, the legs attach, you know, to them, the upper body, the back, the SI joint. So the thing is, a lot of women are like, well, I could only do Kegels and get stronger, but that's a misnomer, right? You can do different types of yoga. You can do different kinds of leg exercises too, because what you're doing is like, it's overflow, right? You're working an adjacent body part to make this body part, the middle of our vagina, stronger. So that's what I love about these muscles, because you don't have to always work directly on them. You can work on your physicality and your mindset too, right? Because if your mindset is one that, and I mean, a lot of the women in my community, because they've been through the Dr. Rose show, they're so despondent and they don't trust anymore, that they've lost trust, not only in the medical community, but they've lost trust in their bodies. Yeah. And I believe, we have to partner off with our bodies. We have to come back to loving our bodies and to trusting that our bodies want to be healed. They want this homeostasis. Everything goes towards balance. We don't go towards unbalanced situation, including our vaginal muscles, unless we're not taking care of them. Yeah. Right. So they're like you train them like you would train other muscles. And the most important thing is also to work on the core, right, in a way that makes sense. Because the abdominal muscles and the pelvic floor muscles, they're like a peanut butter and jelly sandwich. They love each other, right? Mm-hmm. So if there's a scar in the abdominal area, that's going to create big issues for the pelvic floor, because there's too much, the fascial system has been disrupted. And the fascial system is sort of like, it's like the glue that keeps us together, right? And it's the tissue that intercommunicates with how organs intercommunicate with each other, right? Because there is a communication inside our bodies, as we know through the microbiome now. So it's general. To me, it's very simple to do, which is right. But for a lot of people, this can be mind blowing. It's just, you treat it the way you treat any other muscle in the body, and you can't be afraid to touch it. Go in there, massage it. Go in there, release scar tissue. Especially a lot of women have had vaginal reconstruction surgeries, or they're getting even if you get the PRP. Which, I got a PRP for my shoulder, but if you get the PRP for your internal vaginal tissues, it's not going to be the miracle cure. You still have to work on the muscles and train them, right? Mm-hmm. So a lot of people do the Thermiva or the Ultra FemFit, the one that Jada Pickett is always, talking about, or they'll do the PRP. But the thing is, yes, sure, cool. I'd rather that you do that than you go and get some sort of surgery or vaginal reconstruction. Because then I've treated a lot of labiaplasty and vaginal reconstruction, and that becomes a horror show afterwards with the scar tissue. So if you are going to get these alternative therapies, which it's in the market, no matter what, you still have to have a lifelong training program for your vagina. It's like self-care for the pussy. I mean, come on. You
We talk
got to
so
go
much
here.
about core strength, especially, when you're working out and doing different kinds of exercises, core strength is focused on a lot because it's really fundamental to movement in the entire body. And
Yeah.
I really appreciate what you're saying here, because it would seem that the pelvic floor being kind of that basin that is supporting everything through our hips up through our sexual organs, the liver, and everything that's down in this area needs a really good support system, just like our core needs great support. So it makes perfect sense to me.
Yeah. And the thing is, once you start to feel this interconnectedness, because the more you bring, what is it? The more you pay attention to something, the more of it you get, right? And I really believe that, right? Like
Mm-hmm.
thought becomes action, right? Action becomes what we are, right? We become what we think. And so when we're working on the pelvic floor muscles, all of a sudden you're going to start thinking, oh, that exercise really works well. It makes me feel good. It makes me feel lifted. It gives me better orgasms. And then once you start to like track it and track what's actually working, it's like this beautiful awakening, because there's nothing, when I see a woman who's really in her pelvic power, who understands her pelvic health, it's like you can just tell the difference. There's this confidence, it goes into all different aspects of their lives, monetary, business, taking care of your children, your grandchildren. So it's just about getting a little bit more information. And I cover a lot of this in my masterclass, which I think is important that all women attend it, because you're going to get the real deal and the real scope. And those are who really want to move forward, they can always join my program. But at least the information is out there, and I think it's important to give this high quality information so that we stop looking external to ourselves for
Mm-hmm.
answers, right? We can't do that anymore.
Yeah.
I don't want to look outside myself anymore.
Yeah. So I have a question here, and I know we're kind of getting close to our time. A question from Diana. She says, I'm experiencing vaginal and rectal bleeding, no uterus or ovaries, cervix intact. I've been given referral to a specialist, but it would be for surgery, which I would never do. Do you have any ideas on what might help? I've heard a little bit about vaginal ozone therapy for the bleeding.
Yeah, I don't know, but when there's bleeding from the anus or from the vagina and we don't know, that's one of those circumstances where you really need to figure out what's going on, because that's a message from your body. They're saying, why is that bleeding occurring? And I would go to someone who's more on the holistic side of things, that can figure things out, because bleeding is always, it's like a sign that something's going on.
Mm-hmm.
Unless it's bleeding after sex or something like that, then that could be a micro tear or something like that. But just spontaneous bleeding, you have to figure that out. You have to figure that out with somebody who actually knows what they're doing. So this would be somebody like a holistic gynecologist or a functional medicine doctor, because when there's bleeding, um, there's something that's out of harmony, and I don't want to give the wrong advice here. I've heard of ozone therapy. Of course, that's something that you can always try, but I feel like, you also want to know the why, right? Why is that going on? And
Mm-hmm.
maybe track it, really track your symptoms. Because sometimes when you track something, not only track the bad, track the good, right? Because we're so used to tracking the bad that we forget to track the good. Because the good gives you as much information as when you track the bad. So that's something that, when it comes to that kind of thing, definitely, I don't know if it's a hormonal breakthrough bleeding, if she has her cycle. I'm not quite sure what that's coming from, but for that, I would really advise in getting a little bit more information about her health.
So you think a functional medicine doctor would help, or a functional gynecologist would be the specialist to see in that case?
Yeah, totally. Because the thing is, maybe it's something with the bloods. Maybe it's something with the hormones. Maybe something with the nutrition. Maybe it's something, especially anal bleeding. Is she pushing with defecation? Is she constipated? Because a lot of women push with defecation and urination, and that's an absolute no-no. And when they push, sometimes they'll get anal bleeding or hemorrhoids.
Right, right.
But if there's simultaneous bleeding, anal and vaginal, then I'm thinking, okay, what's going on there?
Yeah,
Right. To me, that's like, okay, I need to investigate further, because I
right.
want her to be as safe as possible.
Absolutely. Well, I'm super excited about your masterclass. I am
Thank
signing up
you.
myself. And appreciate you coming on and sharing with us. This has been a really, really important conversation. I hope that all the women in our community get the opportunity to catch this interview, because this is something that's coming up a lot, that a lot of us are dealing with. This is a topic in an area that's a little taboo. It's not the most comfortable to talk about with our partners or our girlfriends. I mean, no one wants to really go up to their girlfriend and talk about how they're peeing just spontaneously or dribbling, at different times or with different activities. But this is life, and it's happening to us. And I'm really grateful, Isa, that you've put this program together to help us get help. And I hope a lot of the women in our community will avail themselves of the opportunity to go through your masterclass. So,
and I want to thank you. I want to thank you for having this forum, for bringing this information to the women, because you're like the light, right? And I love following. I'm part of your community because I love your community. And I love when I come in, all of a sudden I'm seeing a guest speaker and I'm like, oh, I'm going to learn something juicy today, So even for me, it's one, I just feel really, really deep gratitude for you.
Yeah.
That you have this.
I feel deep gratitude to you and all the amazing people in our space who are doing what they can to help us and empower us as women to be able to navigate these different changes of life and these seasons of life without doing the extreme things that mainstream medicine wants us to do, or telling us that everything is normal and fine. And, we just have to deal with it. It's all part of aging. I feel like we have so many resources that can really empower us. And I feel honored to be able to be a bridge for the women in our community, and bringing people like you in to teach us. So thank you so much for sharing with us, and we will see you in your master class, and appreciate all you're doing to help elevate us.
Thank you so much, Misty. Thank you.
All right. Goodbye,
Much love
everybody.
to everyone. Bye.